Is it generally the case that sleep apnea can be viewed as a spectrum and that we have milder forms, moderate, and then more severe forms?
Certainly, and I think most physicians and researchers who are in the area of sleep acknowledge that maybe the first phase of sleep apnea is really snoring that occurs. And this advances on as weight gain occurs. There are other factors that influence the onset of sleep apnea. Weight, we've mentioned, is very important. Structures in the back of the throat, presence of tonsils or enlarged muscular structures in the back of the throat. Facial abnormalities like a recessed jaw and so forth usually sets things back and causes more of an obstruction to the airway.
Any chance alcohol could play a role here?
I think probably most of the viewers have seen someone who's had too many drinks and have gone to sleep and they start snoring very loudly, more loudly than they ever do, and that really will precipitate sleep apnea events. Sedatives do the same thing too. Strong sedating medications can increase the frequency of sleep apnea events and precipitate some snoring too. And we mentioned positioning in bed. That might be a very important factor. In fact, some patients we see, when we look at their study, we see that these sleep apnea events occur only when they're laying on their back. That's the most common position in which these events occur. And rather than going through a lot of treatment phases with various things, including the nasal CPAP we'll talk about, we have them just change their position in bed, and sometimes that eliminates the snoring and sleep apnea events. That's very mild sleep apnea that may be handled like that. As a person has more and more of these apnea and hypopnea events, these stopping breathing or reduced breathing events, the greater the frequency, usually the greater the symptoms, but not always is that the case. And we say that over 15 of these events per hour usually signifies moderate disease, and by convention, over 30 an hour represents severe disease. And generally that parallels the severity of symptoms, sleepiness during the day. And like I say, not always though. Some patients really don't follow the rules very well. We do often see the complications of sleep apnea, most often see them in patients with severe obstructive sleep apnea. That is a number of events like 30 or more per hour occurring every night. They tend to develop some of these complications, or the sleep apnea complicates those diseases if they're present, such as hypertension, coronary artery disease, perhaps cardiac arrhythmias will be worsened because of the reduction in oxygen level during these events.